Welcome to Engaged in Ink. Think tattoos are just trendy body art? Well, think again. Today, we're outside of F.A.C.E IT, where we're going to learn about the important role that tattoos play in the world of medicine.
My name is Annette Rashard. I am a physician in London, Ontario, and I have a particular interest in breast cancer, oncology, and pain and symptom management. My passion is to work with newly diagnosed breast cancer patients especially, and break down the myriad steps that they go through from time of diagnosis to treatment options, etc. I researched the entire process that women went through, from either having an abnormal mammogram or who went in for a routine mammogram and something was found. Either way, what I call the Chinese water torture of breast cancer starts, where you have an abnormality, you have a test, and then you wait, and you have another test, and wait, and a biopsy, and wait, and diagnosis, and wait, see a surgeon, wait, oncologist, wait, radiation, and wait. And so I could not change the fact that it was day surgery, but I started to develop this project that I called F.A.C.E IT. Something that was focused, it was anxiety reducing, community-based, empowering, individualized teaching. So I just came up with that name. And I've been doing that now for about 8 years, where I get referrals mostly from word of mouth, but sometimes from the hospitals if a woman comes through who does not have a GP, has had a biopsy, has a breast cancer diagnosis, and they'll call me to meet the woman, break the diagnosis, and then coordinate her care. I ended up starting a dragon boat racing team that's still going strong. They, in fact, just won the gold in Italy. I was always interested in breast cancer, and I started as a motivational exercise, telling a friend of mine who was 40 when she was diagnosed that when she was done her treatment, we would start this dragon boat racing team, and she would be the captain, and I was rah, rah, rah. There are a number of ways if women decide to have mastectomy surgery, but at any point when a woman has her breasts removed, she will not have nipples. And there are a number of ways to reconstruct nipples using tissue, but one of the most exciting things I've seen is 3D nipple tattooing. That is quite beautiful, very realistic, and if you were looking front on, you would swear that these were normal, regular looking areola and nipple. Beautiful. Only, of course, by looking down would you realize that they were flat.
Hi, I'm Jackie. I'm getting my first tattoo. I'm getting a medical alert type symbol rather than wear the bracelet.
Are you aware that tattoos are used in medicine?
Not really, no. Yeah, that is a complete surprise. I didn't know that.
Are you aware that tattoos are used in medicine?
I was not aware of that, no.
I actually just found that out today.
So, can you give me an example of how?
I was told that people get them, to well, not surgically, but to, replace certain body parts that they've lost, just to kind of, give the illusion of having them.
Are you aware that tattooing is used in medicine?
Yeah. If there's a scar that's annoying and you don't want to be seen, cover it up.
Now we're at the London Regional Cancer Centre to find out how radiation therapists have been using tattooing since the 50s to aid in cancer treatment.
My name's Megan, and I am a radiation therapist at the London Regional Cancer Centre. We're here today in the CT simulator suites where we get patients ready for their radiation treatments.
Not too many people are aware that a radiation therapist actually has a tattoo kit.
So the tattooing comes into play during the planning process for the patient's radiation treatments and every day for their treatments. We actually only tattoo them once, and we use those tattoos throughout their treatment to get them in the right position for the radiation treatment so we can aim the radiation in the right spot of the body. Tattooing's actually been around pretty much since the start of the profession. The profession's only been around since about 1950. In the early days, we would use just a felt tip marker, which was terrible for the patients because bathing was an issue. If they washed the marks off, then they spend a longer time every day for treatment. Whereas tattoos, it's a simple, small little tattoo. We're not drawing flowers or anything exciting along those lines. It's just a little dot, and that way the patients can bathe normally. They don't have any stress when they leave here. And we always know where to position them to give them the treatments.
And positioning the treatment is important.
It's critical. If the patient's not in the same position every day for treatment, the treatment plan that we design for them won't be delivered correctly, meaning the radiation won't hit the cancer and could hit other things like the spinal cord, which if we hit a spinal cord, then the patient may have difficulty walking down the line. So we want to hit the cancer and avoid things that don't need radiation. And the tattoos are critical in getting them in the right spot. We learn it in school. Part of our university training is learning how to tattoo. And it's something that our students have to learn, and we use on a daily basis. I probably tattoo at least 10 patients a day. Well, we use India ink. I'm not quite sure what a regular tattoo artist uses. Me, myself, do not have any tattoos other than the one that we have given myself here in order to use to demonstrate to the patients what our tattoos are going to look like. First off, before they get to this room, they'll meet with the radiation doctor, radiation oncologist, and decide that radiation is appropriate for them. Then the doctor will book this appointment for them, where we'll come in to get them set up for the radiation planning. So this appointment involves us gathering all the information we need to design a radiation plan. So the first step of that is getting a good position that the patient will be lying in every day for treatment, something that's reproducible. So we need to find a position that works best so that they're comfortable, they're not moving. So if they accidentally move their arm, the radiation, is still going to go in the right spot. So that's the first part, is determining the position. We don't do any tattooing on the face. We'll make a mask so that they can't move their head. But anything from pretty much the neck down, we'll use tattoos to show the positioning. And then the next part is us using felt tip markers to start to plan out the areas where we're going to treat, where the marks are going to go. We work on a coordinate system, so we're kind of establishing a 0, 0, 0 point, X, Y, Z, for those who know those. We've given Will here 3 tattoos for his treatment, and we give them 3 tattoos even though we're only going to be treating one side of his body. These 2 on the side here, he has 2 identical ones, are to make sure that he's not twisted in this direction. Okay. This one right here is to make sure that we're in the right spot left to right. And then these ones here also work to make sure he's not twisted this way. So what we'll do is line him up. See these lasers here. So we know that our coordinates, if you imagine Will is see-through, he's in the middle, and where all these lasers intersect in the middle of Will is the center of where we're going to be treating. Okay, so the tattoos on the outside represent a spot on the inside, which is the center of where we're going to be giving the treatment. So we give tattoos not where we're giving the treatment, but they represent the position that he needs to be in to give him the right treatment. So radiation is one of the 3 major treatment options for those with cancer. So a patient may have a combination of the 3 major treatment options, or they might have just one solely. So the 3 options are surgery, chemotherapy, and radiation therapy. So surgery, we all know about surgery. Okay. Chemotherapy generally works for the whole body, so attacks the cancer on more of a global scale throughout the body, whereas radiation, it targets very close to tumors or where tumors were to help get rid of the cancer that way. And it's a really nice treatment option as it's non-invasive. The patient doesn't feel anything during the treatment. They just lay there, relax in the position we put them in, and it feels like a long X-ray. The side effects are fairly minimal, and none of the side effects are right away. They start after a few weeks of treatment, so it's generally very gentle on the patient.
Of course, I'm not a specialist, but having seen the work, I do feel that having cancer surgery is one thing, having plastic reconstructive surgery is for aesthetics. And I think if you really want to have a woman who's happy and feels good about herself and is going to be able to show her changed body to her partner and not feel comfortable, you want the best for her. So I would make suggestions of the people that I've seen. And in fact, when I meet with couples, I have a model, a teaching model that I developed that I show them if they wish to see it, to help the partners school their face so it's not the first thing they see. Because for a lot of women, when they do the reveal, if they see in their partner's face a look of repulsion or shock, they will never undress in front of them again. They'll never take their top off, and it will really affect their life. That's for the rest of their life. So making that difference is huge. As I spoke to women and asked them questions about what it was like, they would say things like, well, it really hurts. Mastectomy surgery doesn't hurt. It really hurts to have surgery under your armpit. It would be really nice if we had something like that. And I developed a pillow. The pillow concept is not new. They use it for bypass surgery. And what to do with a drain, and I developed that. And there was a question like what not to wear to a mastectomy, and I developed a top that's in the F.A.C.E curriculum, fashion curriculum, and I provide the materials, and the students make these garments, and then I give them to patients. So these are all things that I give to newly diagnosed patients. And it just sort of branched out into me focusing more and more on cancer and reconstruction. Most women, if you have a single or double mastectomy and treatment, you usually will not have reconstruction for maybe up to a year. And you have to get on a waiting list and go see people, etc. You've got a long time to think about it. So I think it's my job and my duty to make sure people go to the right person, so they'll be happy.
Here we are at Neon Crab Tattoos in London, where we are just about to open the doors on their 8th annual Pink Ink event. Now, for this event, which is really fantastic, all of the artists here get together for a day to volunteer their time to tattoo pink ribbons on literally dozens of men and women who come from all over the place to show support and raise awareness and funds for the fight against breast cancer.
Hey, I'm Danielle, and I'm here today for the Pink Ribbon event because I unfortunately lost my mom to cancer. So I wanted today to come and get a memorialized tattoo, I guess.
My name is Christine, and I'm here because I have a few things that are close to my heart. Cancer is one of them, not necessarily breast cancer, but I do support the issue. I'm here today to get a red ribbon for heart disease, actually. I lost my mother she was 37 years old from a heart attack. So that's kind of something that I'm here to put on my body to remember her.
My name's Jan Vandekamp, and I'm here today in supporting my best friend who's been battling stage 4 breast cancer for the last year and a half. She's here today with me to get a tattoo as well, and also in support of the 3 family members that I've just lost in the last 3 months to breast cancer.
Hi, I'm Jan Rashard, and I'm here because it's a good cause for breast cancer. I love tattoos. For me, it's personal because I do have breast cancer. Just finished my treatments probably 6 months ago, but I'm in what they call maintenance now. So.
Any color that you get obviously stands for something, and I think that it'll be the same thing for other people, some sort of conversation starter so that they can educate on their cause.
As I said, I was trying to come and support from loss of my mom, and it's been about 2 years now, so I kind of wanted to memorialize her best I can. Gave it some time to think about it and try to make sure that I was doing the right thing, you know?
This is a really important subject to me now because, as before, it never was. I mean, it was important, but not as important. Now that I have it, I know I'm more aware that this is not a very nice disease for a lot of women, including men. That's, not something that's heard of, but it's become very near and dear to my heart. because I even participated in the pouring rain in the Walk for a Cure last Sunday. So, but it's near and dear to my heart. I love it.
I do have one. Looking to possibly get it covered up. It's one of those.
Gotcha. All right.
But that's the only one that I have.
It's a devastating disease, and you know, all you can do is support your friends and your family, like in times like this. So, yeah.
Okay, tell us how it's feeling.
Fine. It feels like, I don't know, like you have like a safety pin or something and you're just like lightly poking. I've contemplated getting tattoos for a number of years, and because I don't wear a medical alert bracelet or necklace or anything to indicate that I am diabetic, if anything ever happened and I didn't have friends or family with me, there's no indication for anyone to know to check my sugar levels or anything. And so when I decided that perhaps a tattoo would be a good alternative, I figured I might as well start with that one. I don't know if it's my last tattoo, definitely my first. Not sure if it'll be my last. Might have opened up a door, but I would say getting that tattoo is me acknowledging that I have a condition that requires attentive attention. Like, it's not something I can just ignore. If I ignore it, it's going to give me major complications, if not immediate, in the future. And so almost, you know, this would be a constant reminder of, you know, you need to take care of yourself. You need to, you know, live a healthy life, take proper precautions, preventative medicine.
I think there's also something to be said about how permanent tattoos are, and so is this condition, disease. You can't, I mean, there's no cure for diabetes, no, as far as I know. So
not as of yet, no.
Yeah. So there's something to be said about permanency.
Checking your blood sugar is extremely important because you can't just guess by how you feel, because as your body gets used to different levels, your body then reacts differently. So getting this is a good reminder for myself to pay attention, and it's helpful. It'll be helpful if anything were to happen and I wasn't able to speak up and say there's something wrong, to maybe, you know, maybe it would clue somebody into, hey, wait a minute, she's diabetic, or there's a possibility she's diabetic, you know, let's check her sugar levels. It's a permanent investment on my skin as opposed to the investment of a necklace or a bracelet. And necklaces and bracelets are important, can also get lost, can fall off. And the placement is important to me because if there was something wrong, one of the first things first response team's going to do is take pulse, and they'll take it at the wrist. And so the first thing they're going to see is the word diabetic underneath, you know, the recognizable serpent and staff, winged serpent and staff, which is a recognizable medical alert symbol.
So yoga for me was something that sort of transitioned out of my personal training. It was this beautiful attachment from strength training to sort of the stretching, meditative side of what that was, and sort of landing with yourself on your mat. So it quickly actually surpassed the personal training part of it and became an enormous part of my life and my world. So yoga for tattoo artists actually started with my ex-husband, who is a tattoo artist, who is a phenomenal man, and he used to complain all the time about his aches and pains. And so what that meant for me was creating a series of stretches for him to do at the end of every day to prevent not being able to tattoo at some point in his life. That caught fire with some tattoo artists about 3 or 4 years ago in Halifax. and just began to snowball. And I did one stretching guide for tattoo artists, which then turned into 2, which then turned into a preventative maintenance yoga class for tattoo artists. So the website is paintedladyfitness.com. There's a tattoo artist corner of the website, which offers both of the stretching guides that are free downloadable PDFs for tattoo artists, as well as the link and the video for preventative maintenance yoga for tattoo artists. So things that are super important for tattoo artists to remember are sort of opening, strengthening shoulders, working all the way down through your hands, arms, to your fingers. Core work is enormous for tattoo artists. Being that you're hunched over all day, it's really important to learn and open up through this area. Hips also become really tight from them sitting all day long. So that's also a really important thing to stretch out. There is not an aspect of the body a tattoo artist shouldn't focus on, but if I could narrow it down into a 5 or 10 minute stretch, we'd focus on shoulders, core, hands, wrists, into hips, and a little bit of core strengthening stuff as well, so that they can do what they love for as long as they possibly can. So tattoo artists should stretch at least every day, 5 to 10 minutes. That's super important. But there's also things that you can do for your hands, your wrists, your shoulders at the beginning of your day, between every client, at the end of the day. The only thing you're doing is putting back into your self-care. You're relieving aches and pains that already exist. You're preventing future aches and pains from happening. And you're giving yourself the chance to have the longevity of your career, which is a really beautiful thing. Tattoo artists do what they love. And having to go back into a different kind of 9-to-5 job because you didn't take care of yourself for 5 to 10 minutes a day could be a pretty scary thing for some people. So it's really important to take that time for you.
So a couple hours or so later, my tattoo is done, and I like it very much. I'm very pleased, and it didn't hurt as much as I thought it was going to. Well worth it.
You get another one?
Maybe, and probably by Mike again. He was gentle.
Thanks for watching. Follow us on Twitter and like us on Facebook, and we'll see you all next time on Engaged in Ink.
Hi, I'm Jackie, and I'm getting my first tattoo.
Okay, let's do that again.
I don't know what happened.
Okay, no, it's okay. We're still recording.
Why is this not staying up?
Hold it a little higher.
It's good? Okay. Employ tattooing.
You almost you got the speed wobble.
I know.
All right, my name is Megan, and I am a radiation therapist at the London Regional Cancer Centre. We're here today in the CT simulator suites where we get patients ready for their radiation treatments. I saw this.
Was that good?
That was good, or should we do it again?
Yeah. That was awful. All right. I know. And everybody loves those. It's like everybody's favorite part of the show.